Welcome, everyone. I'm very pleased to welcome you to this unique webinar, actually. Despite the fact that we've all had hundreds of webinars since this pandemic started, and we've seen dozens of reports from researchers around the world on the impact of the pandemic on civil society, on philanthropy, on giving of various kinds. I haven't seen that much information on how the pandemic is actually affecting research and researchers. So to this community, I'm hoping that this webinar will give us an opportunity to learn from each other, share experiences, and gain strength and solidarity from listening to each other. I'm going to hand you over to start with to Marjorie Daniels of ISTR, who will set this up for us.
Thank you, Ingrid. I just wanted to welcome everybody. I'm Marjorie Daniels. I'm Executive Director of ISTR. And as many of you know, we're a global membership organization with members in 85 countries. And we're trying to adapt. And ISTR has been working on creating a series of webinars. And we were delighted to join with this affinity group because we're also members of WINGS. And basically, both of us are working on how can we best help our research community adapt to these changing times. We both seek to share and disseminate knowledge about philanthropy, and we also do it through our journal, Voluntas. I think the most important thing is that our dual objectives are to connect third sector researchers around the world and to increase the pool of young, well-trained social scientists in the field. Finding ways to shift data collection and analysis that respond to the COVID crisis is crucial for the sector to remain relevant and to make evidence-based policy inputs. Philanthropy has been growing as a research focus among our members, and we're really pleased today to be part of this and provide as much support and research capacity, building capacity as we can as we move forward. So thank you.
In India, we're the first academic center to study philanthropy and civil society in South Asia. And I also serve as a board member of WINGS. WINGS, as Marjorie alluded to right now, is a network of more than 150 philanthropy associations, networks, academic institutions, support organizations, and funders in over 50 countries around the world, whose purpose is to strengthen, promote, provide leadership on the development of philanthropy and social investment. Welcome to all of you. As I've said in my opening comments, it's while the research community has responded remarkably across the world to the pandemic in terms of the speed of response, the comprehensiveness of the response, the agility of the response. There's been an outpouring really of data that's allowed governments, business, philanthropy, and others to respond to the crisis. There's been relatively less attention paid to what's happening to researchers and the research community itself. So we're really fortunate today to have three panelists who collectively bring a width and depth and innovation of experience that is quite unparalleled, really. They're located on 3 different continents and work across a very wide range of research activities. Dr. Becky Moyo, who's not yet on the call, but he will be shortly, is director of the Center on African Philanthropy and Social Investment at the Wits Business School in Johannesburg, South Africa. CAPSI is Africa's only academic center on philanthropy and was established to bridge the gap in the study, research, and practice of philanthropy and social investment in Africa. Becky is a writer, an author, a researcher, and a thought leader who has championed the discourse on philanthropy across the continent for many years now and written extensively on African philanthropy, on civil society, and on governance. Dr. Una Osili is an economist with huge amounts of experience in research and policy. She's also Associate Dean for Research and International Programs at the Indiana University's Lilly Family School of Philanthropy, the world's first school dedicated to increasing the understanding of philanthropy and improving its practice worldwide. Among her many claims to fame, Dr. Osili leads the research and publication of Giving USA, the annual report on American philanthropy, and has led the research and publication of several global indices, including the Index of Global Philanthropy and Remittances and the Index of Philanthropic Freedom. Finally, from my home country, Dr. Sarayu Natarajan is founder of Aapti, a research institution that seeks to generate public, policy-relevant, actionable, and accessible knowledge from the frontiers of technology and society about our networked lives to support the creation of a fair, free, equitable society. Sarayu has a background in management consulting, venture investing, program development and management, as well as academic research. So, as I said, this is an enviable set of talents and experiences and knowledge that we have the opportunity to access today. And I'll dive straight in. I'm going to start. We'll all try to keep our remarks as brief as possible so that we allow for adequate time for interaction with all of you at the end of this. So do feel free right through the webinar to type in your questions or comments into the chat box. If you want to address them to a particular speaker, please do say so, and we'll take it from there. I'm going to start with you, Una. You have, in some ways, the unique vantage point of not just being in touch with what's happening in the US, but really engaging with the global community of researchers, thanks to your work on the indices. What are you hearing from them? How has the pandemic either impeded or altered their work?
Thank you, Ingrid, and thanks to all of you who have joined us today. It's indeed a pleasure to be part of this esteemed group. RADE, as well as ISTR, are exceptional institutions in bringing together scholars, students, and practitioners from around the world. So this is truly an honor. And as Ingrid mentioned, along with our team at the Lilly Family School of Philanthropy, we have been engaged in a global tracking project, understanding how philanthropy is meeting this moment. And as we have started or embarked on this research project, we have reached out to our network of scholars, practitioners, and philanthropy experts around the world. I'll try to share just a little bit of what we're learning. I know my remarks have to be brief, so I'll just provide a bit of a snapshot, understanding that this is an ongoing crisis. We are in a moment that none of us have ever experienced before, and it's certainly a challenge for researchers and the social sector to adapt, to meet this moment, and to be proactive in starting to address issues around resilience, recovery, and building back in some parts of the world. So I will start to share my slides here. Let's see. Can someone advance the slides? I'm having some difficulty doing that for some reason. Does not seem to be. Okay. So just to mention that from the beginning, we knew that this was not just a crisis that would affect one country or a region, but the entire world. In some ways, this is different from other disasters, other shocks that the world has seen, because there's virtually no unaffected region or country. The other way that we've been studying this is by expanding our methodologies and our tools. And we're seeing this around the world, whether it's sub-Saharan Africa, Latin America, Europe, North America. The social sector has had to pivot to move into a world where most things are taking place virtually, if not all transactions. And so this is leading to a greater reliance on technology, on new tools, but it's also leading to new models of collaboration that are emerging across government, the private sector, and the social sector. So all three sectors meeting this moment. The next slide, one thing to just keep in mind, as we have approached our global tracking, we've asked some key questions. The first one is, what is philanthropy like in this moment? How much is being given? In what time frame? Which organizations are benefiting? And ultimately, I think to Ingrid's question, how is philanthropy and the social sector changing in response to COVID-19, which is both a health shock and an economic shock at the same time, and still unfolding, no clear endpoint yet in many different parts of the world. On the next slide, I just want to give a sense of the tracking that we're doing. In addition to the survey we fielded across the 79 countries that the global indices measure, we've also been collecting data where it's publicly available on charitable giving. This actually follows a lot of the tracking work that the Lilly Family School has been engaged in since September 11th. On the next slide, I just want to briefly give you a sense of what we know already and some of the findings from the different countries and regions. So first, on the donors, the totals, and the timeline. What do we know so far, and how is that different across the world? Now, as you can imagine, this is not an easy project. Ingrid sort of alluded to this. We're collecting data in a pandemic, which means that organizations are being impacted. Even the researchers themselves may be dealing with health issues, economic issues. And so adding all these has made this certainly a challenging but important project and very timely. On the next slide, I just want to mention some of the key challenges that have emerged. For many researchers, this pandemic is on an unprecedented scale. As we mentioned already, it's both a local and a global crisis at the same time, and many communities are still, if not in the peak of the crisis, at some point in that crisis. In addition, there's been an expansion in the use of different types of vehicles. So tracking philanthropy and the work of the social sector means looking at the work through different lenses and understanding that increasingly nonprofits and funders have to use these new digital media to communicate and to engage with their stakeholders. On the next slide, we alluded to this already, but there is aggregated data for many different countries, but there's still a lot of countries where we're trying very hard to fill in the gaps. Notably, you'll see that the disparities in countries mirror some of the work that we've already seen, where in some countries there are agencies and organizations that are reporting these totals. And there's a call to action here. We need all of you on this webinar today to join in this effort so that we can have for the first time a global picture. Several colleagues are working on this, I think, already around the world. The next slide will look at just very quickly what we know from a country level perspective. Interestingly, the response does not always fit what you might think. In other words, we've seen that in some countries, it's corporations and foundations that have really played an important role. In other parts of the world, we're seeing individual donors really step up. And it's worth noting that in the United States in particular, corporations have been very important in the COVID-19 philanthropic response, but in places like South Korea, we've seen individual donors really rise to the challenge. On the next slide, I just want to mention some innovations in this crisis. So in addition to the challenges, we've also seen an opportunity for creativity and innovation, and specifically the rise of national funds in many countries, relief funds that are operating at the national level. Turkey is a very good example. We've seen examples in France and Switzerland. And then finally, one key point, as countries have navigated the organizational, environmental, and economic challenges, we've also seen another source of innovation, and that is the rise of crowdfunding campaigns, with the World Health Organization for the first time having a global crowdfunding campaign, and here in the United States, the CDC having standing up a crowdfunding operation that has raised more than $50 million to date. On the last slide, I'll just save the rest for perhaps the Q&A. The very next slide, I just want to mention one last point. Can we just have the very last point is that one of the biggest insights, can we go back just one? There's a need to really improve data on global philanthropy. We're finding right now that we do have good data at the national level in some cases, but it's more difficult to find out about cross-border flows and particularly regional resources that might be available. And I'm hoping that one outcome of our discussion today, and some of you may have suggestions, is how can we build on some of the national partnerships we already have in place to expand to more regional and multilateral partnerships. Our goal is to use this tracking project on global philanthropy ultimately to really learn about the global philanthropic response. We've seen philanthropy innovate in this crisis. We've seen new forms of collaboration, but we've also seen some real opportunities and challenges in collecting new data, especially on new vehicles around philanthropy. So I'll stop here, and hopefully we can come back to some of these issues during the Q&A. Thank you.
Thank you, Rina. This is the researchers on the call. I'm sure that many of WING's members who are national associations, for example, can play a critical role in actually sourcing and compiling and sharing some of this data. I'm going to turn to Sarayu now. Sarayu, besides your own research work at Aapti, you've also convened a couple of discussions among researchers in India to share experiences of working during COVID-19. What are they telling you? What are the main obstacles that they and you have had to contend with, and how are they adapting to this situation?
Right. Thank you for that question, Ingrid, and it's an absolute pleasure to be on this panel. I'm going to focus my comments and thoughts, and I also noticed a couple of the people that spoke on our panels that we organized are also here, so hopefully they'll jump in at the right time to say a little bit more. I'll focus my comments on talking about what we see in the field, a sort of research that informs policy or philanthropy or giving in order to sort of make it more effective, more efficient, more targeted, and sort of more oriented towards getting the outcomes that are desired. I think there are sort of three levels to which the problems with research in the time of the pandemic operate. And this in some ways is complementary to the lack of availability of data on sort of other ends. But the process of data collection itself is one level. Then there's the level of the inference, and the last is what I call serendipity, or an important process, I think, in research. And I'll talk about each of them in turn. So talking about data collection, social science researchers who are on the field, who are using evidence in a certain way to inform either policy making or philanthropic activity, rely on two kinds of data, right? There's the observational data where the researcher or the person who's in the field observes something like, does this house have a tiled roof or something of that sort, and then notes the observation. And then there's the ability or the question that is targeted at eliciting a respondent's perception towards certain things. Like, would you feel comfortable using this welfare program? Would you feel comfortable using this product? And it could be a range of things, like it could be an opinion, it could be a feeling, it could be a response. Now, both of those have become distorted in a certain way in the context of COVID, because both of them rely on that physical interaction between the researcher and the individual in the field. So the observational, of course, is completely now transformed into having to elicit it through a question. So do you have a tile roof or do you have a bathroom becomes the new kind of question. And then, of course, the how comfortable are you, or sort of the feelings-based questions also become a bit complicated, because you cannot observe it, So it's only an answer that you're recording. So it's only a data point or a fact that is being recorded, but it does not have any other sort of import or meaning that is attached to it. And I think that that is one very significant element, because one of the presumptions that you have about research or being able to use research is that this level of filtration, or this layer of sort of the researcher subjectivity in looking at these things is almost automatically factored in. And now suddenly you're in a situation where this information is not unavailable, but it's just that the modality of conducting it is somewhat different. And I think keeping that in the frame as one interprets the research is very, very critical. The second, of course, is inferential, which is the next layer at which this sort of pandemic has distorted the research process itself. Specifically, it applies much more, or is, I guess, magnified in the context of qualitative and interpretative research, where an ethnographer or somebody who is using their own subjectivity to interpret what they're seeing becomes very significant. So when we receive data as researchers from the field, the ability to code, which is a process that researchers follow, is a bit complicated, because intuitively the coding process, while you might be relying on some kinds of methods to code, you also know how to weight certain pieces of evidence. My legal training, it taught me a wonderful word. It's called the ring of truth. And this is not truth versus untruth, but it's just that subjective knowledge that something has a certain weight versus another. For example, sometimes you're coding interviews from two different categories of respondents. So you would have a range of politicians, and then you'd have citizens on the field, and they're talking about the same thing, but the researchers need to code the interviews differently for the same content. And that is also assessed not just from the denominational terms that are used, which say this is a ward official, or this is a politician, or this is somebody, but also your understanding and your own experience interviewing this individual. And so that is again something that becomes very complicated in the time of the pandemic, because that physical interactive process is not there. Now, the third aspect that I'd love to sort of focus on a little bit is this idea of serendipity. I am none of this is to paint a bleak picture of what the pandemic has done to research, but serendipity in research is something that's almost entirely vanished in a certain way. Or rather, I guess we need to start having the conversation of how we reimagine the idea of serendipity. A lot of how we think of this in research is embedded in the idea of a researcher going out into the field context and then finding something there. So just to give you an example of what I mean by this, this was during my doctoral research. I was out in the field. It had been months, and I'd been asking these questions with no real purpose. I knew that my PhD would be about brokerage, political intermediation, housing, and migration in some form or fashion, but I did not know what that specific research question would be. And then I was taking a walk in the community that I was doing my field work in with an informant, and all of a sudden, and he was a local political leader, and all of a sudden he says, in this area, and he points to one part of the the community that we were working in, and he says, in that area, I'm a very different person. I'm a totally different leader than I am in another part of the community. And then that was the moment where I realized that the area that he was pointing to was an area with informal housing, where the residents did not have title to the land. And that was that point. That was the moment where I realized it was really about access to titling. And then how does political intermediation differ when you think about title? Right? It was just that one moment. And it might seem a little bit like like a Ponzi, where you're building your entire thesis or all of your research on this one moment. But these moments are critical. Now, it's not to romanticize or fetishize them or say that without this, research is all meaningless. And there's a whole lot of sort of elements of power and politics associated with this idea of serendipity, even because it's only certain amounts of privilege that allow you to even think in this sort of way. But there is something to it. There is something that goes into all levels, whether it's the inferential level or the data level, but it's really something that underlies and ties together research. And this is again something where I see it both as a sort of loss in a certain way, but also an opportunity for us to think about what does serendipity mean if research is going to be fairly digital. And then therefore also thinking about questions like exclusion, because if you think about the research process, and that's something that ties together all of these aspects. If you're relying on methods like phone surveys or digital surveys, those who do not have access do not necessarily have a voice in these research processes. There's also the big paradox, because there is some evidence that in certain types of community activity, women take the lead, but in patriarchal societies, they do not necessarily have the same access to technology. So what are you talking about when you're talking about telesurveys? Because it excludes whole populations who might be marginalized. Often this kind of research is done in very dominant languages, because if you're relying on technology, it enables you to conduct research only in certain languages, which means you're automatically talking about exclusions in very diverse populations, like say in India. So I think there is a whole lot of loss in a certain way, but I think, and we'll probably also talk about this as we go along, there's a whole lot of opportunity that some of these breakdowns or ruptures from traditional ways of doing research allow us to have. So I'll stop there and...
Thank you, Sarayu. I think I see Becky on the call. Becky, are you on the call?
I am. Can you hear me?
Hi, Becky. We can hear you. So, Becky, from your vantage point, where you are looking at a picture across, 33 countries across the African continent, what are you hearing, what are you seeing in terms of hurdles or obstacles that researchers are encountering and how they are adapting to this context?
Thank you very much, and my apologies for joining a little bit late. So we are currently working with a group of associate researchers who are affiliated with the center, and we have about 3 projects that we're running across 33 countries. The first is focusing on understanding the high net worth individuals. The second is understanding the landscape of other forms of philanthropy and their expressions. And because of COVID-19, of course, I mean, I'm sure at some point I will talk about the opportunities and some of the new things that it has introduced. We are tracking the impact of COVID on philanthropy, social corporate responsibility, and the non-profits, among others. But I want to probably look at the study of the high net worth individuals, because I think, as a result of COVID, that's where we've got a lot of challenges, in the sense that some of the high level respondents or subjects of study are not really that tech savvy, and so most of the time they would have preferred face-to-face interviews, focus groups, among others, and that's not possible given the current conditions. And so we have had to postpone some of our interviews and schedules with them. Some of them have got trust issues when it comes to the use of technology and what could happen with some of their information, data, among others. And so there are delays basically in terms of some of our high level respondents. But when it comes to some of the forms of research we are conducting, actually COVID has presented us with a lot of opportunities. And some of those opportunities quickly is that the potential to increase the sample size has become even higher, and so we are now able to survey, especially when it comes to survey technology, approaches, we are able to survey people across the continent and beyond, something that we could not have done before because we had to do face-to-face, interviews and all of that. Secondly, it has become even cheaper because, travel across the continent for us is very, very expensive. But with the use of online technologies and research methods, that has made our work even much, much cheaper. In fact, we have been able to do more now with some kinds of research that don't require travel than we did under the traditional forms of research. But we have also seen increased, collaborations across multi-teams, but also across countries. And so the scope for collaboration for us has increased simply because there are so many people who want to conduct research on COVID-19 at this point in time. And so, having to do individual research seems to be causing a lot of fatigue in the sector. So you are better off identifying each other across the continent and doing collaborative work where you collect data at once and analyze it. And in fact, the data analysis has also become faster for us as a result of the online tools that are there. But I should also say that there's fatigue in the field now. I mean, people are over-researched, especially since January 2020 as a result of COVID and its impact. And so the way in which we go into the field now, we have to be very careful about that research fatigue that has kind of kicked in. But I think finally, surveys are more practical now for us than interviews or focus groups. But where interviews are possible, we have learned to keep them short, precise, and relevant. And this is because, like I said, we do have a lot of people who are fatigued. I mean, people live online now, and it's more exhausting actually to do work online than if you did it the traditional way. And so we have had to adjust some of our strategies in terms of how we conduct research so that we keep it relevant, we keep it short, but we also keep it very exciting in a collaborative manner.
Thanks, Becky. There's a question for you, Sarayu, which is from Edward Dixon, and it asks you to delve a bit deeper into the intersectionality of exclusion across gender, class, geography, etc., especially in an Asian context. So do you want to speak to that? Do you also want to talk maybe about some of the new opportunities that the pandemic has thrown your way?
Perhaps a little bit around the opportunities. Am I audible? I can't hear you, Ingrid. Did you say something? Okay. Yeah, right. So, talking about the opportunities a little bit, and I think I'd love for, my colleague Lakshmi as well as Katie from Janagraha, who I noticed was on the list of participants, to jump in here in terms of talking about the opportunities. I think there are a few things that have happened, and we can talk about each of them in turn. The first, and I think Katie spoke about it a lot in the panel that we did, as well as it's something that's come up again and again in conversations that we've been having, is that what the pandemic has done is both made partnerships important, but it's also made partnerships the way to take research to solutions. It has, so it's not just a sort of question of how do you get better data to do research, but it's also become the pathway of sort of deploying solutions that are generated through this process of field research. Now, it's important to think about those, and partnerships. By partnerships, I think the typical examples are finding the right kind of civil society organization if it's for something in the ground, or finding the right government institution if it is for something that is larger and more aligned to work that the state is supposed to do. So this is very critical, and I think it also ties in a certain way to this aspect that we keep hearing about. What the pandemic has done is that it's highlighted very many blind spots in this idea, or it's complicated this idea of evidence-based policymaking. Evidence-based policymaking has actually just been framed around, here is the solution, then how do you sort of find the right evidence to make this work? But what has happened now in a certain way is that the enormous gap between what the problems are and what is known, or what is in a certain way measurable and visible and available, has become apparent. And so I think one of the other panelists in one of our events also spoke to the idea that what the pandemic has done has made these gaps, these distances between what is known and what is unknown very, very apparent. So it has sort of created this willingness in a certain way amongst a range of participants to engage in partnerships. So the pathways to research, from research to solutions, are not just tightened because you know better, but also because you're more open to knowing better. And I think that that has become a critical shift in how we think about research in the time of the pandemic. And it's a huge opportunity. I mean, it's a tipping point. And if governments are very, I mean, they're the big daddy of like very many things, right? And if they're willing to engage, this might be a time to sort of think about how do you do it constructively, how do you do it positively, and with regard to sort of democratic rights and values and principles. The other, I think, aspect of what the pandemic has done is that it has foregrounded community. It is in a very complex way, and I'm going to struggle to explain this, but for sure. But I think what it has done is that very many of the ideas that have been operational have focused on the idea of an individual. But what the community has done is, what the pandemic has done is shown how important it is for these ideas of collectives, for these ideas of individuals coming together, whether it is to, do work or volunteering work within local communities. So it's about matching demand and supply in a certain way, or the need to sort of collaborate, to come together to co-create certain solutions. So there's a whole lot around community that this pandemic has thrown up. And I think it's almost an opportunity that we should not lose. And particularly as you think about how much more technology will be deployed on the ground for a range of things, thinking about community and its relationship with sort of these technologies, as well as more broadly to the state and other institutions of power, is definitely very critical at this point. The third, and I think, again, this is something that's come up repeatedly in conversations as well as in the panels we did, is the idea of sort of this field research community. It's social science researchers arrogate to themselves like a whole lot of like capability and thinking, and imagine that research exists because of them. But the fundamental architecture upon which this is built is the researcher in the field. And the researcher in the field has now to play a double role. So they're not just transmitting information or data or to some extent inference about what they see, but they've also often become the ports of first call for a lot of sort of like management and relief. And just to give you an example, in some research that we've been doing, researchers in the field have been called upon to do a whole lot in terms of, can you give us access to some phone number? Can you help us contact the government officials? Because very often for certain kinds of communities when you're doing research, these are the individuals who are seen to have power. And I think that researchers and the research community, and it's a complicated relationship with power, the community does not spend enough time thinking about this sort of critical architecture. And I think what the pandemic has done in a certain way is foregrounded this whole community in terms of the role they play in not just facilitating research, but actually going beyond and above. So I think these are the opportunities, and obviously it's not just about saying these are somehow going to be transformed into solutions and we're going to all do research better, but I think thinking very carefully around these opportunities and building in a certain way can be very useful. So those are my thoughts. Should we talk about this question of intersectionality or come back to it?
Maybe we'll come back to it. I just want to hear from Una actually on one, what are the big new opportunities that you have seen, but also a question for you, which is around really the collaboration between public, private, and third sectors. I mean, what are the forms that these collaborations are taking? And is it too early to say whether they have long-term potential? Una?
Thank you. Yes, I will try to quickly provide probably the most important opportunity that the pandemic has made clear is the need for equity and inclusion in the work that we do. COVID did not cause inequality or poverty, whether it's gender-based or race and ethnicity, but it's made it much clearer to see these disparities across education, health, and a number of other areas. So one call to action, I think, for the research community is that it does make it easier for you to add that to your research to really think about how are marginalized communities being impacted. I think the second opportunity that COVID has opened up is access to online and virtual data. In the past, research communities really struggled to build these partnerships with private sector entities who are collecting data, whether it's aggregate or household level. And increasingly, we're finding that it's much easier to do that, both in the United States, but globally. And that's a real opportunity for the research community. We've already talked about the challenges of field work and survey and other traditional forms, but there are newer ways of collecting data that are made possible. Just pivoting to say what we're learning about collaborations, especially the government, private sector, and social sector partnerships. What's interesting is that we're seeing them in both low-income countries, high-income countries, middle income, across the board. In the United States, for example, the shift to virtual learning for students meant some students, because of the digital divide, did not have access to tablets or even internet access in the United States. So private donors stepped up, community foundations, corporate foundations, to donate those tablets and to also provide access, internet access to students. So that was nonprofits working with the government and also working with the private sector. Interestingly, Nigeria, something very similar happened. So you can see these same solutions. Here was television stations working with the schools, working with the NGOs to get access to not virtual learning in this case, but televised classes through the television and radio stations in some communities. So I think the important part about this experience for the research communities, how do we take some of these lessons and build on them and build back better? And so that as we, from the research standpoint, can start to document some of these very successful examples of partnership that we can then build on as communities and countries and regions start to move into, hopefully, the recovery phase.
Thanks, Srinath. Becky, you want to speak at all to this question on have you seen COVID impact not just at our high net worth individuals, but also what's happening at the grassroots?
Yeah, thanks. I'd already noted the question. So there are two things that we have noticed. So there's a positive impact and a negative impact. So the positive impact is that we are appreciating the role that communities play in pandemics of this nature. In fact, our governments in Africa, the majority of them that are led by liberation movements, adopted the militaristic approach in the beginning, and kind of used a top-down, hard lockdown among others, and that did not work until they realized that they needed the community to be involved. And so the idea that the community must be at the center of resolving pandemics is something that has been elevated to another level right now. In fact, we are also finding that in all pandemics, whether man-made or natural, that have happened in the continent, including Ebola, among others, the local communities are the first to respond. And that is an important observation that we want to also to highlight. And so solidarity has been on the increase. And in Southern Africa, we talk of Ubuntu, which in other places could be Arambes and others, which is that I am because you are, and that seems to have been brought back to the heart of this pandemic and how people have actually helped each other cope with the demands of COVID-19, even though financially and otherwise they were actually affected. But I think this has also been an opportunity for grassroots organizations to adopt new ways of working. But from a negative point of view, of course, this has exacerbated the inequalities that already existed, and one of them is access to financial resources. And so most of these groups had to either shut down their operations, others have had to cut down on their staff, among others. And so programming has really been affected, and some might even struggle to come back and build better as we go forward. So there's really a mixed bag in terms of the impact that we are picking up, especially for the non-profits and the grassroots organizations. But I think the levels are more or less incremental as you go up to the professionalized groups, to the companies, among others. Yeah.
That certainly mirrors what we're seeing in India. Sarayu, there's a question from Katie to you. She says her connection's a bit sketchy, but really, and I think it's an important question, which is the questions around ethics. And one, the fact that we as a community, as a research community, really need a broader conversation around it, as well as the idea that of accountability. Do you want to speak to that and maybe also touch on the intersectionality issue?
Yes, definitely.
We have about 10 minutes left.
Right. I'll be super quick. I think the point on ethics, and it's my bad for missing this out, but I think it's an absolutely significant one, and it's something that's come up consistently in the context of research in the time of the pandemic. And I think Becky also mentioned it in terms of there's a fatigue amongst communities, there's sort of a tiredness with a whole range of circumstances besides sort of the interest in research. And I think ethics goes to some of these concerns around sort of fatigue, around tiredness, around some of the complications of doing research at this time, when there are a whole lot of other things that are in a certain way very relevant or important to think about. I think also some of the conversations around ethics is that there is not really a standard set of ethical guidelines outside a few institutional contexts, right? The IRB, there's not even like a value system in a certain way for how IRB should be governed. So it's fairly ad hoc. I mean, different, and it differs by context, so different geographies have different approaches, but certainly in India, there is not really a standard. So there is very much a possibility that some of these research relationships, and I think that ties in a certain way to broader questions of intersectionality, but you have very complicated kind of relationships with the field. So I absolutely think the conversation on ethics is important, and some of the things that have come up is the idea of potentially collaboratives of researchers coming together to at least begin to establish a certain set of norms. Whether you can sort of attach liability to them or not is not certain at this point of time, and that's very complicated. But what could be relevant is at least articulating some of these sort of principles for good, like ethics, as a sort of set of norms rather than necessarily something enforceable. So that's definitely one thing, and I think this question of accountability is also something that has come out, as Katie mentions, in the context of a lot of research, and it's in a certain way also one of the opportunities that emerges from this pandemic, because this idea of making a claim on the state has become something that has become much more overt. It's become much more feasible, much more possible, and some of it is enabled by technology. And I think that to see research as framed within this broader context of seeking accountability from institutions around you is something that the pandemic offers, and I think that it's something definitely worth building on. This question on intersectionality, I mean, I think the idea of exclusions from the margins of technology is a reality across, but it's also very empirically or like very contextually specific. So the ways in which they operate are very much determined by a whole range of sort of individual conditions, in the sense that your identity and your sort of individual status matters in the levels of access and how do you even think about engaging in research, but it's also very much influenced by the socio-political context. And I do not want to say anything more than the question of intersectionality is one that, or sort of exclusions and margins that emerge from these intersectional contexts, is something that goes both to the realm of like method, like pure method, like what kind of data can you get, right? Even to infer for the questions you want to ask, but it also goes to the realm of like, how do you do ethical research when you're thinking about contexts such as ones where there's huge amounts of exclusion. And this is especially important to think about in terms of what gets included and validated when you're using technology for research, because I mean, some of the points that were made earlier around like it validates or normalizes a dominant language, a dominant paradigm of asking questions. So to parse what goes into like more generally ethics and what goes into data is hard, but it cuts both in some ways. And I hope I answered the question adequately, but there's a whole lot there to discuss in terms of how do you do research ethically.
It's really interesting because at the last ISTR Global Conference in Amsterdam, I know at the event that Wings convened there, the topic which elicited the highest amount of interest in that the research community was actually data ethics. So maybe Marjorie and Dinkim were on the call. Maybe we need to think of a whole webinar that's just dedicated to data ethics. I'm going to ask Una, really, there's a question here about, do we have concerns about accuracy and validity of data when we're using these more digital data collection processes? Una?
That's a great question, and I think we have to be concerned about accuracy whenever we are using some of these newer methods of data collection. On the transaction side, one could argue that there is more accuracy because those are actual financial transactions people have undertaken. But when you're collecting maybe demographic data, other kinds of information online, what we have done is, as much as possible, collect the data from multiple sources, so that even if it's multiple platforms, so that we can cross-validate and see where there are discrepancies. I also think that alongside the data, as much as possible, having qualitative information, that might be interviews with the individuals who are actually practitioners who are processing those transactions, or with donors and nonprofits themselves who are participating in those transactions. We do have an opportunity, especially in this moment with concerns about fatigue of respondents for surveys and focus groups, to really pull together these multiple strands of data. And where there are several platforms, you can then use the benchmarking from maybe a national source to look at the regional data and to look at the transactions by platform. So enormous opportunity, and one that we are actually taking an opportunity right now to learn as much as we can about the growing virtual and digital world, and a lot more philanthropy is taking place through those channels.
Thank you, Anna. Becky, any last words? Becky?
Okay, thanks. I was trying to unmute myself. So I think one of the points that I wanted to raise is that, during this period, we have seen that there is an increased availability of data. And I'm happy that the question around concerns of, the authenticity of data has been raised. So the COVID-19 has really produced a lot of data in fields such as philanthropy. If you look at what has happened in Africa, and I'm sure in other parts of the continent, there's been a lot of giving, and we've been tracking that, and the amounts are really big. I mean, they show that people actually give to certain causes that are very close to them, and they give even much higher during times of pandemics like this. But there's also been lots of data emerging out of issues of governance, for example. While there's been so much giving and solidarity, there's also been a lot of governance issues, either whether it relates to those resources or to corruption, among others. But there's also a lot of data emerging out of the third sector itself in terms of how it has been impacted upon by COVID, but also its responses to COVID as well. So I think this is a moment where there's just a lot of data available, and I think the real trick among researchers is to be able to prioritize what to research now, and what to push further. And for us, we have come to understand that we probably need to focus our attention more on the impact of COVID and the responses of the sector. And some of the research that we're doing in order to just scan the field, we have moved it a bit further so that once this moment is gone, we'll focus on that later.
Thanks, Becky. I know we have literally 2 minutes, but I can't miss a question from Kerry, who's asking, what are some of the specific digital data sources that you're using? Cell phone data, data from online.
Right now, it's mostly data from online giving platforms and household survey data. So we're using both, and by using multiple, both large, small, local, and national platform data, we're able to do a lot of that validation, and the accuracy questions can be addressed in real time.
Well, thank you all. I mean, I'm shocked actually by some of the similarities we're hearing from multiple continents. I mean, it's interesting to see how a digital divide is operating in the US as opposed to Africa, as opposed to India. It's interesting I don't think there's a webinar I've been on in the 6 months of this pandemic where collaboration has not been the overriding theme that has come shining through. I think clearly that the opportunities are at least as many as the challenges we're facing, not just in terms of the scale of the research we can do, the pace at which we can do it, the cost at which we can do it, but also the opportunity to do kinds of research that we've never done before, or to reach groups that we typically leave out of our conventional research, but equally then a set of groups that have become more muted, if you will, or more inaccessible because we are limited to digital ways of reaching them or telephonic ways of doing them. I'm particularly interested, I think, in having a follow-up conversation around the values and ethics of research that are getting thrown up by the pandemic, and to figure out how we could maybe work together to actually evolve better norms for us as a community. The last thing I do just is to thank each of my fantastic speakers and all of you for signing in today. Thanks to Wings and ISTR for organizing this. It's been a fascinating conversation. Look forward to seeing you all in the flesh again soon.